Good evening and welcome to Here and Now's special coverage of the COVID-19 crisis for Newfoundland and Labrador. I'm Carolyn Stokes. We're starting early today and we'll stay on the air until 7 o'clock Newfoundland time. That's because in about half an hour, the province is going to release its COVID-19 projections for this province, how bad things could get here and when we might come out of this. Now, Peter Cowan is joining me in the studio tonight. He's been at nearly every medical briefing since this pandemic started. So for the next half hour, we're going to take your questions live and see if we can find out the answers for you. You can send your questions through Facebook, where you can also watch us live this evening, or you can email your questions to hereandnow.nl@cbc.ca. But before we look forward, let's start with having a look back. It's incredible to think how much has changed in all of our lives in just the past month. This time last month, we hadn't even seen our first case of coronavirus in this province. Today, the number of people confirmed to be infected is 232. This virus has killed 2 people in this province. So let's start by turning back the clock. The new year began with an epic snowstorm, one that gave much of the population a taste of indoor living during a state of emergency. That record-breaking snowfall on January 17th was nicknamed Snowmageddon. On that day, coronavirus starts to make its mark. Wuhan, China reports its second death, but the virus is spreading, and just over a week later it hits our doorstep. Canada sees its first case in Toronto. In this province, a now familiar face delivers reassuring words. Tell us, how worried should people be?
Well, the overall risk for Canada and for Newfoundland and Labrador is low from a public health point of view. It isn't unexpected that we would see some cases here in Canada, but overall the risk is low.
But by January 30th, the World Health Organization declares a global health emergency, and this province begins to brace for the inevitable.
I think it's almost certain that we will see cases.
We have detailed plans worked out with Canadian Border Services to screen anybody who was identified or symptomatic.
Then infections escalate around the world. 114 countries are affected. The WHO declares a pandemic.
We have no cases here as yet, right? And we do anticipate that we will see cases here.
Dozens of people in this province are being tested and told to stay indoors.
Individuals and families considered to be at risk for developing COVID-19 are required to self-isolate and are not permitted to attend work or school.
On March 14th comes confirmation the virus has landed on our shores. The first positive case is announced in the Labrador-Grenfell area. The person had returned from a cruise in the Caribbean. Days later, restrictions begin to ramp up.
Effective immediately, we are suspending all in-school class instruction throughout the province, early childhood education and daycare centres, and also the College of the North Atlantic.
The words social distancing become commonplace. People with underlying health concerns are told to be careful.
Anyone who is at increased risk for severe disease, we would recommend that they try to socially distance themselves as much as possible. So stay home as much as you can, try to avoid large crowds, try to avoid busy times of the supermarket or Costco, maybe Costco altogether.
The daily briefings start to bring daily increases in the number of cases.
As of today, Tuesday, March 17th, there are 3 presumptive positive cases of COVID-19 in Newfoundland and Labrador.
Next comes a milestone. A public health emergency is declared in the province. Businesses like gyms, bars, and movie theaters are ordered closed. Gatherings of more than 50 people are banned. Anyone returning home from international travel is ordered to self-isolate for 14 days.
Last evening, we learned of our 4th case of COVID-19 in Newfoundland and Labrador.
We are in uncharted waters here.
Restrictions continue to tighten. Each new day brings new rules.
Today, any individual returning from out of the province will be absolutely required to quarantine for 14 days. We must act now. If this situation wasn't serious, we would not be doing this.
Then we start to see drive-through testing locations. Traffic on the streets and parking lots is thinning out. The caseload soars from 9 to 24. Call's funeral home discloses that people who had attended visitations may have been exposed to an infected person. Warnings from government and health officials become more severe.
The only safe assumption for anyone in this province is your next-door neighbor has this virus.
More non-essential businesses are ordered to close. Visits to long-term care homes are no longer allowed unless a loved one is dying. Funerals and weddings are limited to 10 people. Canada Post in St. John's shuts down after 5 employees test positive. The Liberal Party suspends its leadership race. The concern about the mental health of people in isolation becomes part of the conversation.
We've talked about social distancing, but really I think that may be a bit of an inappropriate word. We've talked about physical distancing. We really need people to remain socially connected.
Then comes frustration as news circulates that some people are breaking the rules.
It still baffles me that we are still hearing stories of people getting off planes and not going straight home.
March 25th sees the biggest jump so far with 32 new presumptive cases in 24 hours, bringing the province's total to 67.
At least 44 are associated with Call's funeral home.
Some of you are simply just not taking this seriously. One of the consequences, or some of the consequences that we put in place, would be fines. So in addition to fines, we are immediately taking away your driver's license.
The reality of the situation is setting in. Government continues to warn this is not a sprint, it's a marathon.
What we're saying is, what do we need to keep life going at a basic level over 3 months? This is not 3 days, it's not 2 weeks, this is at least 3 months. And we're only into the beginning of week 3.
The number of infected jumps to 120. We see community transmission for the first time. On March 29th, the first death. A 78-year-old man is killed by the virus.
So we are facing another heartbreaking day for our province.
Today, I am deeply saddened to report that there has been a second death related to COVID-19 in our province.
But how many more deaths and infections could this province see over the course of this pandemic? Tonight, government will give us a glimpse into what the future may hold.
Possibilities, these are probabilities, and they are looking at the future through a fuzzy telescope, a fuzzy crystal ball. But they are things that we need to do because we need, as administrators, as civil servants, to try and be able to plan on your behalf for the worst case scenarios whilst hoping for the best.
So in about 20 minutes or so, we'll be getting those projections from the provincial government. Now, some other provinces have already released their projections on how COVID-19 could affect them. They outlined worst case and probable scenarios. Alberta released its modeling numbers yesterday for how COVID-19 could hit that province. And like Newfoundland and Labrador, Alberta is facing both a health crisis and an economic crisis. Let's take a look at the projections in that province. In a worst case scenario, infections would peak at the beginning of May with as many as 1 million cases and between 500 and 6,600 deaths. Now, under the probable scenario, Alberta could see between 400 and 3,100 deaths by the end of summer, plus as many as 800,000 infections. The infection rate is expected to peak in mid-May.
These numbers can be overwhelming, but these models are not a done deal. I want Albertans instead to see them as a challenge, perhaps the greatest challenge of our generation. How many people are infected, how many die, and whether we overwhelm our healthcare system, all of that depends on us and our choices.
Like our province, Alberta is bracing for an economic impact from COVID-19 because of collapsing oil prices.
Now Western Canadian oil has fallen as low in the past week as $3 a barrel. There is a very real possibility that as global inventories overflow, our energy will hit negative prices. We'll be paying people to take away our energy. I cannot overstate how grave the implications of this will be for jobs, our economy, and the financial security of Albertans.
Well, let's have a look at Quebec now. Health officials warn thousands of people could die in the next few weeks from COVID-19. The province released its projections yesterday outlining how the pandemic might unfold. Quebec has the largest number of cases in the country. For Quebec's worst case scenario, there could be nearly 60,000 cases and nearly 9,000 deaths by the end of this month. Under its optimistic model, officials expect just under 30,000 infections with more than 1,200 deaths by the end of April. It's expecting to hit the peak infection rate on April 18th. So far, there have been 150 deaths in Quebec from COVID-19. Quebec's premier says residents must keep up physical distancing and follow all of the restrictions in place.
I want to be very clear. This doesn't mean we can ease our efforts. We cannot spoil all that we've accomplished together in the last few weeks.
So those are just two of the several provinces that have released COVID-19 projections, and going to bring in Peter Cowan now. This is the sort of detail we're expecting to see here in this province tonight at 6 o'clock from the government.
Yeah, Carolyn, we're going to hear from the Premier. I got a chance actually this afternoon to speak with some of the officials, and we've been given a sneak peek on those numbers, but I'm not allowed to share them until the Premier starts speaking at 6 o'clock. So, but the good news is we did get a chance to sort of question officials. The one thing that is important to know here is that because we are a smaller province, we've had fewer cases than those two provinces that we heard. The Premier, or the Health Minister, has warned us that that's why our projections are coming a little bit later, because the more data you have to feed into the model, the more accurate it's going to become. So there are definitely a whole bunch of asterisks. You know, this is not this is what's going to happen. They're going to give us an idea of what could happen based on a couple different scenarios.
Yeah, the what if scenario. What if this happens and what if that happens? So we're going to have a look at some questions from people. Throughout the week, we've been doing a few of these Facebook Lives where we take questions from people. So let's have a look at one here that was emailed to us. If I test positive but show no symptoms, how long is it before the virus leaves my system? Now, you're not a doctor,
no.
But you've been paying very close attention to all of the briefings that have been happening since this whole thing started. So what intel do you have on that? Do you have an answer?
Well, no, because this is a brand new virus. Even the fact that there are some people who have this disease and never show symptoms is a brand new statistic. And that's why we've seen, for example, the change in the recommendation from there's no point in wearing masks to there might be some benefit to wearing masks. So they right now know that there are some people, they don't know how many, and so they haven't really done a full study looking at how long someone might actually be showing no symptoms but still spreading the disease. So it's a good question, but it's not one that even the health officials are able to answer right now.
Right. Okay, another question. Why do we continue to have the second lowest testing rate per capita? Is it because of a shortage of test kits or lab capacity in this province?
We've heard from the health minister that they want to be judicious with the use of how many of these supplies, because every test you need a swab, you need personal protective equipment for the person who's swabbing you, you need capacity at the lab, you need something called reagents, which is a consumable supply they use every time they do these testings. So what they're saying is we want to make sure that we're only doing testing when there is solid evidence that there's a high likelihood that this person might have COVID-19. Right now, in order to get a test, they're using, have you traveled? Have you been in contact with someone who's tested positive for COVID-19? Or are you a healthcare worker or someone who works with vulnerable populations who have a bunch of the symptoms for COVID-19? The reason, obviously, they're concerned about healthcare workers is if someone does bring that into a healthcare setting, that's where you've got your most vulnerable people. Those are some of the people who have been hit hardest we've seen elsewhere in the country from COVID-19.
And one of the big concerns right now is this upcoming weekend, right? Because it's Easter weekend, and a lot of times people get together, families want to get together and have dinner and socialize. So there's a concern that the numbers of cases could pick up this weekend. What was the Premier saying to the public about travel this weekend?
Right, because first of all, the answer was only essential travel. If it's not essential, if you don't have to do it right now, you shouldn't be out and about, you shouldn't be going. Officials are worried about this weekend because all it takes, we saw from Call's funeral home, all it takes is one infected person to go to a group gathering and the disease can spread quickly. They're concerned if someone says, you know what, it's only my family, I'll have Nan and Pop over, I'll have, my cousins over, we're still gonna stay inside the house. That's where you can then all of a sudden see one person infected there can spread the disease quickly. A lot of people are also wondering the cabin. Should I be going out around the bay to my summer home, open it up a little early? Nationally, the advice has been COVID time is not cottage time. They've said don't do it. The advice here at the provincial level, we saw the Premier answered this question yesterday afternoon, and he was a lot more vague. It was kind of like, you probably shouldn't go, but he wasn't saying no. Here's how he answered the question.
I know that people would want to go to the cabins, but there's always touch points along the way. You fuel up, you pick up extra groceries, you do extra things. So, for me personally, I would like to see people stay home, as they say, stay in their bubble, stay safe, and stay away from those touch points. Realizing that for those that are asymptomatic, there's sometimes a need to actually do some things. But the big thing in all of this is be responsible. My suggestion is for non-essential or essential travel only.
And this is the sort of thing that we're going to see in the projections, right? We're talking about the what if. So we're going to see scenarios, what if people don't follow that advice?
Right, and what we've seen in other provinces is the scenario of like, if we didn't have a lockdown, we just said, you know what, we're going to let this disease run its course. And we see the disease spread a lot faster, or what's the more probable scenario with the lockdown that we've seen in place right now?
Okay, let's get to another question. Sure. How do we know there isn't more community spread if average individuals in the community don't qualify for a test even when they're ill?
That's an excellent question, and it's one that I've actually put during the briefings. And the answer from the Chief Medical Officer of Health is one way that they do see community transmission is if you go into the hospital because your symptoms are so severe, they will do a test. And we see lots of people go into hospital with influenza every year, and they will continue to test. So if they're going to test you for influenza, they're going to test you for COVID-19 as well. So they say if this was rampant in the community, they would see lots of people coming to hospital who developed more severe symptoms because of this, and they would test and they would see it there. The good news is right now they've only seen kind of 3 or 4 cases where someone has tested positive where they haven't been able to trace it back to either travel, contact with another individual, or that Call's funeral home cluster where we've now seen more than 150 cases all related to that one event.
And that Call's cluster, that is going to really skew the projections that we're going to be seeing today, right?
Right, and that's one of the concerns that we heard from the health minister before is, our scenario is very different. This is the largest cluster in the province, in the country rather, and we're a very small province. So about 75% of our cases are all tied to that one cluster. So that kind of means we only have that 25 that's actually really indicative of how this virus might normally spread through the population here in Newfoundland and Labrador.
I have a question here, a good question, I think, that I'm actually curious about the answer. Lori asks, can you walk someone else's dog if you did not come in contact with their owners?
What we know so far is the disease does not spread through pets. That's what experts have said, because a lot of people are worried, like, my dog's licking my face, my dog goes lick someone else's face.
What about their fur, though? Can it be on their fur?
And I guess there's a theoretical chance that if someone had the disease, they coughed on it, those droplets, and then you might, have wiped their fur. But so far, we haven't seen any advice from officials in terms of, like, don't walk other people's dogs, because that's a concern. The concern is mostly around prolonged contact in close quarters. That's why everyone talks about that 2 meters. If you get closer than 2 meters to someone for a longer period of time, I know, for example, in Ontario, they're using like 15 minutes as kind of the, when they're screening people. That's where the big concern is, rather than, because the other thing is the dog's outside, they're rolling around in the snow or the grass, they're busy drinking out of a puddle. There may be lots of other, ways that they bring something back, but so far that hasn't been highlighted as a concern. So right now there's no advice saying don't walk someone else's dog.
And just heading back to the Easter weekend, the Premier has said that stores are allowed to open during the holiday. What are some of the concerns there, and why did he choose to do that?
And we've seen a lot of people saying, well, hold on a second, don't workers need a rest? They've made it clear that this is optional, so no worker can be forced to work on Good Friday. But the concern is if stores are closed Friday and stores are closed Sunday, that reduces the amount of shopping time. Through this whole period, the encouragement has been stores open for long periods of time because that helps with social distancing. We even saw places like Costco today, people anticipating the Easter weekend, there's big lineups outside the store. Lineups are what they're trying to avoid. But here is how the question of why this move was made was answered by the Premier.
This will be one of the busiest weekends ahead of us, a weekend that is typically filled with food and Easter gifts. So rather closing stores 2 of the 3 days on the weekend, we're giving grocery stores the option of closing just one day. The option to open is simple. It's to protect you, the customers, and the employees. This is about controlling the volume and promoting physical distancing. It's an option for businesses to consider. They're not required to open. It's about providing flexibility.
So that's the advice about stores, although it's interesting to note Dominion has already decided that they are not going to open on Good Friday, Carolyn. Okay. But otherwise it is up to individual stores to decide, do they have the staff? Do their staff need a break? But the encouragement is the more amount of time that stores are open, the easier it's going to be. Also worth pointing out that workers who do decide to work, they get paid double time. Okay. So they do get paid extra for having to work on that holiday.
And with the projections that are going to be coming up in about 8 minutes or so, one of the things I guess they're going to talk about will be healthcare capacity, number of ICU beds, that whole idea of flattening the curve. Arthur Green wants to know, how many ventilators does the government own? What's our capacity for that?
Well, right now, they have 156 ventilators sort of spread out across the province. They have ordered 20 more ventilators to try and up our capacity. The good news is, on a per capita basis, we've actually got lots of ventilators. One of the bigger issues is it's not enough to just have the piece of equipment. You need the ventilator technician to actually be there monitoring it, operating this piece of equipment. So that's one of the reasons why they've said, hey, if you are a retired vent tech and, come forward, we don't need you right now, but there may be a time when we're having to put all 156 ventilators into use and we'll need extra help. So it's funny because there's, you need the ventilators, you need the ICU beds, you need the staff to operate this. There's a lot of pieces. You need the personal protective equipment for those staff. In order for the system to be able to handle the surge, there's a lot of pieces that need to be in place.
Fred Douglas emailed us a question. He says, is there an age breakdown of those who have recovered?
We haven't had an age breakdown of those who've recovered. They've given a breakdown in terms of the ages of people who've caught the disease. And tonight, I think we may also get a sense of an age. They're going to look at some of those ages in the projections as well. But we don't know who, in fact, the good news out of today's numbers is there was actually a jump in the number of people who've recovered. We're now up to 74 people who've recovered from this disease. So it is worth also pointing out that when we talk about those total numbers, that includes everyone who has been diagnosed. So they don't subtract the number of recovered people on a daily basis. That number of cases will, the best case scenario is that it flatlines and, it's not going, that number won't go down.
Right, so the 232 number, which is our latest number, that includes the 79 people who have recovered.
Right, so you'd have to do a bit of math, subtract the people who've recovered, and then also subtract the 2 deaths that we've seen in the province if you want to know how many people actively have the disease right now in Newfoundland and Labrador.
Amy Canning wants to know, should people be giving and receiving treats like homemade food and goodies? She says she's seen this on social media a lot of people doing this. Are you allowed to, what's the advice from health officials about giving someone homemade food and treats and stuff.
And we haven't seen that addressed directly by health officials, so there isn't specific measures. When they've talked about groceries, they have said, you know, some people I know are deciding to use like a disinfectant wipe on the boxes. We know things like cardboard and cloth don't carry the virus very well. It doesn't survive very long on there. The one thing is wash your hands. Every time you're handling something, you know, so you would hope that it might be wrapped. When it comes in, you want to wash your hands after you've handled it, just in case there is anything, for example, on the outside of the package if it's picked anything up. So the advice, you know, wash your hands, wash your hands, or wash your hands. It may seem simple, but officials keep going back to that as the advice for trying to make sure that you don't end up picking up this virus.
And you know, we've heard some heartwarming stories come out of all of this as well. There have been multiple parades around the province for essential workers, thanking them, people showing their appreciation by going in a motorcade, honking their horns, that sort of, which is lovely to see, but the government did address this. What did they have to say about that?
And they've shut it down because it's not just thanking essential workers. We've seen it for birthdays, you know, kids who were supposed to have a birthday party. Instead, you can either have strangers coming by and honking or some of your friends and family driving by and waving from the window, things like that. And what we saw from the Department of Municipal Affairs has actually put out a notice to all fire departments and all municipalities saying, please don't do these. Dr. John Haggie, the Minister of Health, addressed that in the briefing, and here's why he says there's a health hazard, even though people are in their cars.
These motorcades originate somewhere and end somewhere, and that at those beginning and end points, again, you've got the kind of parking phenomenon I've alluded to with other things, teens, adults in coffee shop parking lots, where social distancing, physical distancing is breached and not observed. And again, that is a cause for concern. That is the kind of place where inadvertent transmission of the virus is going to happen.
When we saw John Haggie go back to this issue of people in cars getting together and they think, oh, I'm in my car, so I'm okay. But if you roll down the window and you've got another car parked next to you, you know, and there's, you know, you're only a meter away, that's still not the physical distancing that they say that we're going to do. And that'll be the interesting thing when we look at these projections is the question is, you know, these hardships that we're taking right now, because it is hard to be distant from people you want to get together with at Easter. It is hard when you can't go out to a store and buy the things you'd normally be able to buy, when you're supposed to be limiting your trips. So the question is, what's that payoff? What is it that we're getting in return for taking all these sacrifices, including things like, you know, you can't get your hair cut, and you can't take a trip, all these things. So I think this is one of the things that we're going to be looking for in the numbers tonight is, you know, what is the payoff in terms of how many people are we going to keep out of hospital? How many, you know, trying to keep those numbers down, mostly so the healthcare system doesn't end up looking like it does in Italy or even more recently in New York, where you see a big surge of cases all at once, and we don't have the staff, the equipment, the beds to be able to look after people. So, you know, I think that's one of the reasons why they wanted to release this before the Easter weekend. They wanted to give people an idea of, you know, if you do what you're supposed to this weekend, these are what the numbers are going to look like. But if you decide, you know what, I deserve a little treat because I've been good and I deserve to be able to get together, this is the, you know, the other path that we could go down, the one that we don't want to go down.
Right, so this could serve as a motivator for people to keep doing what they're doing and not get complacent at this point in time, because we are seeing fewer numbers, fewer cases each day, as opposed to the big jumps, which...
Right, although it's important to note, Dr. Fitzgerald, the Chief Medical Officer of Health, did point out, you know, we shouldn't read into the fact that yesterday we had 2 new cases. Today we were looking at 4 new cases. Like, those are definitely low numbers, but she said that doesn't tell us anything. It's the long-term trends we need to care about. All that tells us is we had 2 cases yesterday. That's the only thing we should read into it. So I think it's too early to tell whether or not that's going to become a longer-term trend, or if that's just a blip that we see over a couple of days.
Okay, so if you're just joining us, we're waiting now to hear from the province. Gonna give us some projections, some modeling, some worst case scenarios, a best case scenario, supposed to be starting at 6 o'clock. But until we get to that live news conference, I have another question here from Tracy Stride on Facebook. She wants to know if there is an updated location map of today's cases.
So the government has been putting out a table with where those cases have been in Newfoundland and Labrador. They've been updating that every day. The map right now is still, last time I checked, about 2 hours ago, the map was still based on the health authority areas, but there is a table. So if you want to know in St. John's how many people have the disease right now, or on the Bonavista Peninsula, or in Clarenville, all these areas are broken down. And we saw this week that I think it did drive home for a lot of people. As the health minister said, this is not a towny disease. It is in a lot of communities already right now across the province.
Okay, excellent information, Peter. Thank you so much, and thanks to everyone for sending in your questions. This is a special show, a special coverage of the COVID-19 pandemic in Newfoundland and Labrador. The provincial government is set to release its projections of the impact of the illness. Over the next 45 minutes or so, you'll hear from the Premier, the Health Minister, and the province's Chief Medical Officer. You'll also hear from Dr. Proton Raman, a clinical scientist with Eastern Health and professor at Memorial University. So they're looking at what could happen here because of COVID-19. So while we wait for this to get underway, let's have a look at the situation in the province right now. There are currently 232 cases of COVID-19 in the province. 6 people are in hospital, 2 in ICU. 2 people have died. 74 people have recovered so far. So we're hoping to tune into this news conference in which the Premier and the Health Minister and the Chief Medical Officer will be offering up some projections, some best case scenarios, worst case scenarios of what could happen in this province over the next month and couple of months, really. So while we wait for this to start, should we bring Peter back in for a question? Oh, here we go. Here we go.
As we head into the Easter weekend, this is the first big opportunity since Christmas where we usually gather at a church or around our supper table with family and friends. Now we have to accept that this year is very different. What has been normal throughout our lifetime has changed. To put it bluntly, your actions this weekend and beyond determines our future. What you do this weekend will make it or break it. Now, joining me this evening is Minister Hagee, a familiar face to us, and Dr. Fitzgerald, and Dr. Proton Raman. At this time, I want to introduce Dr. Raman as he's a new face to many of you. He's a clinician, scientist at the Eastern Health, and a professor of medicine at Memorial University. Now, we've asked the Newfoundland and Labrador Center for Health Information to bring together a team. And we've asked them to consider various modeling scenarios to help inform our health system planning for the COVID-19 pandemic in our province. It's a fact some of you will require hospitalization. So this team will help us plan and prepare for your healthcare needs. The team includes experts from various areas, our regional health authorities, the Department of Health and Community Services, and Memorial University. Throughout this, they've had guidance provided by the Public Health Agency of Canada and engaged with others like the University of Toronto, the University of Oxford, and the Departments of Mathematics, Statistics, and Computer Sciences at Memorial University. Dr. Raman leads the core analytics team, and he is here this evening to present this team's work. As you will soon see that Dr. Raman's presentation, we cannot let up. Every single move you make this weekend and beyond will determine our future. It's your choice, and I implore you to make the right decision. Now, Dr. Rahman is an intelligent, a soft-spoken person, so I please ask you to pay attention as I hand it over to Dr. Rahman for his presentation.
So thank you, Premier Ball, for allowing our group to present. So I'm presenting on behalf of the work that was done in our group for the last 10 days or so. So the mandate of the Predictive Analytics Group is really to look at the trends in terms of the cases that we're actually seeing, determine what the clinical consequences are for our patients regarding having COVID-19 in the Newfoundland population, and then try to determine and forecast the capacity in terms of the healthcare system. And that's really important in terms of patients being admitted to hospital, ICUs, the need for ventilators. But it goes beyond that in terms of looking at what are the needs in terms of human resources, the needs in terms of personal protective equipment, as you're aware, has become in such great demand. Also in terms of reagents for testing, for which, again, there's a big demand. But for today, what I'd really like to do is to focus the presentation on two different things. First is to look at the current situation. What is our current trajectory of COVID-19 and how it actually compares to the other provinces? How are we doing in terms of our ongoing public health measures that the Premier said were quite aggressive, but I'll show you why it's really appropriate and has made a huge impact. And then subsequently discuss the characteristics of who is affected in Newfoundland and how are they doing. All important questions that you want to know. And then the second part of the presentation, we're going to look forward and we're going to try to project in terms of what is going to happen to us. The issue of thinking forward is actually worthwhile, but there's a lot of caveats towards modeling, and we'll first discuss those important limitations and challenges in projecting cases, and then we're going to show you scenarios, short term, in terms of acute and critical care bed needs, and then as well, two possible long-term scenarios. And possible long-term scenarios is what you have to remember. These are what-if scenarios and not necessarily married in that much science as of now. So what is the current situation in terms of COVID-19 in Newfoundland? So the first thing you have to always remember, as Dr. Fitzgerald announces the cases every day, is that we're, in terms of population, the second lowest in Canada. So you take the numbers and then you have to correct it for the population size. We're seeing a lot of graphs nowadays, and a lot of the things that we actually see are bell curves. The thing to remember about this particular graph is that it's the cumulative number. In other words, it doesn't actually come down, and the best response that you can have if there's no further growth is that the curve turns flat. So let's look at the trajectory of what's happened. So around the third week of March, there was a rapid increase, almost like the COVID virus just sprinted out of the gate, and there was almost an exponential growth. This would have been very, very worrisome if this were to continue, and you can just look at the province of Quebec as a comparison in what happens when you actually reach that phase in terms of exponential growth. So this would have been catastrophic in terms of our healthcare system with very little warning to have so many cases. But something actually happened, and if you actually project forwards over the last week of March and May, the trajectory of the curve has changed altogether. And you have to ask yourself, what happened? What happened is public health measures. They identified that there was an issue in terms of the rapid progression in terms of the number of cases that we've had. Just through hard work, really an organized and a swift response team that actually did manual contact tracing. They were able to identify the case, test it appropriately, then subsequently either self-isolate or quarantine, depending on what your test result was. And then they did that in parallel with other measures, such as physical distancing, and as well in terms of non-essential work. And this has made the impact. This is what's really flattened the curve, and you can actually see it. And these are real numbers and not modeling. So everything that we're actually doing, as hard as it is, has made a huge impact. So now our curves are very much like Canadians. So much has been talked about with BC, and they've flattened their curves. It doesn't actually look that much different. They're still a little bit higher than BC, but overall very, very encouraging in terms of what it's been done and the organized response has really helped avert a disaster. Let's look at our population a little bit quicker, and there is a story behind these curves. So if you actually look at just the trajectory for the total patients, it doesn't actually tell you what happened. One particular event, for all sorts of good reasons, but at the wrong timing, led to a rapid increase in terms of progression of the virus. And the trajectory in terms of cases from the funeral home, as you can see, it looks quite a bit different than what's in our community elsewhere. So when you actually see two curves going different way, it's going to be hard to some extent to model. But the more important issue and the story behind this is that it just takes one small indiscretion in a large setting to actually lose control in a small place in terms of what can happen for the virus spreading. So please, please, please follow the social distancing measures that are actually in place that Dr. Fitzgerald and Minister Haggie talk about. So now look at the health consequences of having COVID-19. So this is a novel coronavirus. Novel means that you haven't seen it before. No one's immune to it. So what that means is that anyone can get it. Those less than 5 have gotten it in Newfoundland. More than 90 have gotten it. But it actually spans all age distribution. Some can argue, well, the young individuals, most of them do well, 80 to 90%, which is excellent. But the issue about being well is that you still carry the virus, you still spread the virus. So everyone has to be responsible in terms of not trying to transmit the virus, whether you're that symptomatic or just mildly symptomatic. You still are a carrier, and it's really important to understand that particular principle. So the other thing to look at is who's actually getting sick. Sick defined by, if you have moderate to severe disease, you'll come into hospital. If you don't do as well, you get into the ICU. State after state, province after province, it's noted that people that are older, particularly those over the age of 70, don't do well. We don't see it in our data right now because we don't have as many individuals in that particular age group, but they should be particularly cautious. But the other message that we're seeing that's also seen throughout North America is that young individuals are ending up in the ICU. So here, for our ICU admissions, you can see that 18% of the individuals were in the age of 20 to 44. These are young people that think that they're healthy, and that's where they've ended up. So please respect the virus. It can make you quite short of breath and lead you to places that you don't really want to go. Is there any other predictors in terms of who is going to have a poor outcome? It's if you have coexisting medical conditions. I think about coronavirus. I think what actually brings you into hospital is you're breathless. If you have an underlying respiratory disease that your baseline is such that you're short of breath, whether it's asthma, COPD, heart failure, you're at risk. If you have underlying cardiovascular disease, ischemic heart disease, or if you have diabetes, you're also at risk. These are similar to what's been noted in other populations, but it's really important to think about for your own health. The thing that we have noticed is that people that are coming in to the ICU or coming into hospital have many more of these so-called comorbid illnesses or additional medical illnesses than those that are able to actually handle the virus well. So if you have 2 or 3 of these conditions, you have to be extra vigilant in terms of what you're doing. So essentially what we're trying to tell you is that we had a rapid increase in terms of our population. The public health measures made a huge impact and was really the only thing that actually changed the curve. There's no treatment for it right now, no vaccine, no medication. How did things happen that in a beneficial way? It was through the public health measures that were implemented. So now we're going to move into looking forward, not the data that we have, but what can we learn from the data and then project ahead. So modeling, as it's been talked about a fair bit in the press, is conceptually helpful. If you think about these what-if scenarios, it'll help you in terms of planning, help in terms of public health measures, in terms of healthcare utilization, and obviously has economic and societal ramifications as well. So it's helpful to think ahead, and some of the changes you want to make are not easy to implement, and it'll take some time as well. The issue with modeling, however, is that it's frequently wrong. It can be misleading, and that's because there's numerous underlying assumptions, even if the assumptions are grounded in the best evidence that we have. The issues regarding the coronavirus are evolving. Even if you stay abreast of what's actually established, there's still guesstimates at the best of times, and so the models are often misleading. That being said, it's worthwhile thinking about various scenarios that we'll present today. The unique challenges that we have in Newfoundland about the modeling is that 75% of our patients are from the funeral home cohort, and their dynamics in terms of viral transmission are actually does not actually follow the normal distribution. And as a result, clustering in Newfoundland is especially hard because of that variance of where the patients are coming from. Often clustering is done with a large number of patients, particularly deaths. So thankfully, we've had only 2 deaths, and obviously our heart goes out to the family members of the individuals that have passed away. But the lack of deaths also means that it's hard to project based on that particular parameter. There's also other technical issues where modeling is difficult. So what's our approach to look ahead? Our approach is a real pragmatic one. Let's get the data to drive the model, and let's think that this is a work in progress. What are we confident about? We're confident about short-term projections. So this is much more variability the further that you go. So we would like to tell the healthcare system what's happening next week, what's happening next month, and then let's just think about possible scenarios, but not really have certainty parameters beyond that. We want to look at consistency with the model that we have developed. So we're going to bring in a partner in the Canadian Institute of Health Information to see how their model fits with ours. And we're going to reach out to the universities, as Premier Ball said, to the Stats, Math, Computer Science Department, to pandemic experts in University of Toronto, as well as to some individuals in Oxford, to look at their models to learn from them. One of the things we may actually have to do at some point in time is maybe build a model that actually looks and accounts for that cluster here in Newfoundland. But the most important thing we're going to do is to refine our model frequently, so that once we get enough data points and have a better idea of where we're going to rerun it again. So constantly keeping an eye on what's happening, and then subsequently revisiting the number of cases that we have and see if we can refine our model. With all those assumptions, let's show you a couple of graphs. So this, you often talk about in the press about the best and the worst case scenario. I'd really like to talk to you about the current case and then the worst case scenario. And so at the present time, if there is no social measures in place, the virus will do what it does. So that's something called the reproduction number of R0 of 2.3. So if we remove the measures right now, you can see that there'll be a slow exponential increase. This is by no means the peak, but at the end of April, we already have 200 individuals that are admitted to hospital. If, on the other hand, we follow current measures, and this is actually the implementation of these public health measures, has driven that reproduction number down from 2.3 to at least 1.5, you can see that the cases are much more manageable in terms of healthcare system, and we can let and take care of other things. So that's great. So if we continue to do what we're doing for this month, okay, we're actually doing well. In terms of if we don't follow things, we still have the capacity right now in terms of hospitalization beds, but it's only a matter of time before it catches up to us. So let's take the same model and look at it in terms of critical care beds. Why critical care beds? That's a real scarce resource because it gets saturated very, very quickly. And if you don't have access to critical care when you need it, then the case fatality, or the number of people that pass, increases very, very quickly. So when you need the ICU, you actually you have to have a bed available for you. And so when you actually look at the ICU capacity with those same parameters, we'll actually run out at the end of this month, because our bed capacity in terms of what's the beds that we have available as of yesterday was 57. If, on the other hand, you're continuing with the social distancing measures and the things that have been put in place by the Ball government, you're actually fine, okay? But I shudder to say that, and that's because things can change very, very quickly. We're already made aware that there is one individual in a long-term care home that has COVID-19. So why is that an issue? We all know that people that are in long-term care homes are older, have multiple illnesses, are in close quarters, and that's been a hotbed in terms of transmission. So it's not going to take very much to change the dynamics. So even though we're projecting, what we're saying is that this is a best case scenario for the present time, but things could evolve very, very quickly. And all of a sudden we sort of have to rethink and readjust in what we're actually doing. But at the present time, given the data, what's actually been done is working, because if you actually look at the projection, initially there, and this in green is the actual number of beds, it's actually starting to go down a little bit as compared to the projections, which is great. And so if the projections are overestimating, that's even better news. The next two slides are a little bit harder to explain. And this was done with a partnership with the Canadian Institute of Health Research. So they used a compartmental SEER model that assumed a mixed homogeneous population. It's pretty much the same thing we did. We looked at our 1 month result, and to the individual case, we actually matched perfectly. We looked at their hospital admissions, and the numbers were very close. So we're using a similar model to try to tackle this issue. But what they had was an outlook of what could potentially happen. So in the scenario from the Canadian Institute of Health Information, their assumption is assume that 1/3 of the Newfoundlanders over a 2-year period will get coronavirus. And this would be a reasonable number if we actually maintain our public health measures at the present time. So if 1/3 of Newfoundlanders were actually going to be exposed to the coronavirus, okay, given our total bed capacity, we'll actually be able to handle that in terms of our healthcare system. Given the number of present ventilators that we have, we barely make it, but we can potentially do it. But really, there's really no wiggle room there. But let's look at it in terms of our ICU capacity. This is just a model. We're not saying this is what's going to happen. It's projecting well beyond the time frame that you have much certainty about. But in this particular model, it's saying that the end of June, you're going to reach capacity. Sometime in October or November, you may need 100 more ICU beds than are available right now. So our system has to adjust if that's the case. You know, we have to be much more prudent in terms of who's taking up these beds. We'll have to find the recovery rooms, operating rooms, in terms of increasing our capacity. But the most important thing we can actually do, if this were to be the case, is to actually double down on our public health measures and flatten the curve even more. The more you flatten that curve, the easier it is for our healthcare system to actually accommodate that change. Given the present model, and with all the caveats regarding the model, we're actually short in terms of ICU beds because it's over capacity. It reaches capacity around the end of June, early July. If, on the other hand, okay, you assume that 51% of Newfoundlanders have the COVID-19 virus, that's just catastrophic. It brings us so that the peak is a little bit earlier. A huge number of patients come into hospital. Our ICU is going to have difficulty coping, and we don't have enough ventilators. We're hoping we never get there, and the way to do it is to be really, really stringent in terms of self-discipline regarding the measures that they're promoting right now. So in summary, I purposefully did not put any slides in terms of numbers because it's not really about numbers, it's not about treatments. This is about non-pharmacological measures, in other words, public health measures, because this is what's clearly helped in terms of a significant impact in flattening the curve. So we need to continue this, but more importantly, we have to further improve our efforts to achieve the best possible outcome, because the future outcome for COVID-19 is highly dependent on the collective effect, the collective effect of our individual actions to stop its spread. Thank you.
Well, thank you, Dr. Rahman, and thank you for your projections and the work that you've put into your presentation tonight. It certainly paints a clear yet stark picture of why we must remain vigilant. What we do this weekend and beyond will make it or break it. Your actions this weekend and beyond will determine the turning point of this virus. We know that there's no certainty in predictions. The information we have is based on data, and that can, of course, change. But what is certain? That everyone is susceptible to the COVID-19 virus. and we know that everyone can transmit it. Now, we've had a few tough weeks in Newfoundland and Labrador, and you know, we had what is widely known as a cluster at a funeral home, where a lot of people got infected in a short amount of time. Thankfully, we were able to contain it by contact tracing. But in saying that, we lost 2 people in our province due to complications of COVID-19. We have 2 families that are grieving. 2 families that have lost a loved one. At this point in time, they can't even provide them with a wake or a proper funeral. They can't hug or console each other when they need it the most. That's devastating for these families. We don't want that for yours. The reality is, it could easily be you. You could be next. Your parents could be next. Your grandparents could be next. Or your child could be next. Now, when you talk about who was most susceptible to this deadly virus, it's people between the ages of 55 and 64. That's me. That's some of you. We are the ones who end up in ICU. And when you look at our population, well, that's where there's more of us than anyone else. Those are not the words that I want to share with you tonight, but these are the words that I have to share. As COVID-19 takes lives, it's only about your actions that we will save lives. It has no boundaries. Age doesn't matter. Gender doesn't matter. Postal codes, well, they don't matter. This virus isn't based in St. John's. It's not based on the Great Northern Peninsula, and it's not based in Gander or Labrador or even in my own community of Deer Lake. It's everywhere. You have to act as though the person in front of you has the virus, because they might. You're only one step away from this virus, a step away from bringing it into your community. You are not invincible. We have a lot of people in our province that want to put some positivity in people's lives. Well, I do too. I've heard stories of people wanting to go back to familiar church services or host outdoor movies, do parades to wish people a happy birthday or celebrate an anniversary. They're all great intentions. Your hearts are in the right place. But you can't. It's simply not safe right now. By doing that, you would be increasing the risk of spreading the virus. Now, we know what we're asking of you, day in and day out. It's difficult. That's the point we're at right now. We've put guidelines in place, and we're asking you to follow them. Only go once a week for essentials. Travel only when it's essential. The virus only moves when you move. That's its greatest strength, but it's also its greatest weakness. Just follow the rules. We still have a long way to go, and I know it's hard. But in order for any of us to have any sort of a future, we must remain vigilant and not let up. Together, let's take a hold of the virus and not let it take a hold of us. I will now turn it over to Dr. Fitzgerald for her comments.
Thank you, Premier. Good evening, and thank you for joining us today. Thank you, Dr. Rahman, for sharing this information with us this evening. And while it remains early in this disease's trajectory to make projections, your presentation helps us to put things in perspective. Early data indicates that our public health measures are having the intended effect. I want to thank everyone for your efforts. By staying in your bubble, physical distancing, washing your hands, and going out only when it's necessary, you are helping to curb the spread of COVID-19 in our province. While this information is encouraging, I need you all to understand that this is just the beginning and our work is not done. We must continue to abide by the public health measures that we have in place. We are in this for a long time yet, and as difficult as it has been, we must keep the pedal to the floor. As Dr. Rahman referenced, now is not the time to become complacent. It is time to double down. If we ease up on our efforts, 2 weeks from now will be a very different picture, and 2 months from now will be catastrophic. We still have the opportunity to reduce the spread of this virus in our province and keep our loved ones and ourselves safe. How well we adhere to these public health measures this Easter weekend will determine how COVID-19 will look in the coming weeks. We now know COVID-19 is contagious before a person is symptomatic, and we have always known that when we move, the virus moves with us. We have seen firsthand right here at home how quickly and easily this virus can spread. As hard as it is, this year calls for a different Easter tradition, one that keeps us safe in our protective bubble and our families and friends safe in theirs. The sacrifices we make this weekend will bring us all closer to a time when we can resume our lives and move forward, doing the things we enjoy with the ones we love most. Leaders of our faith communities are offering services online. For individuals and families who would have attended church this Easter weekend, you can now join in from the safety of your own home to embrace your faith and celebrate what Easter means to you and your loved ones. I know that what we are asking you to do is hard. I know that there are personal consequences for all of you. I also know that these measures are what will work to reduce the spread of COVID-19 in our province. These measures will help keep you and your loved ones safe. Today, for a change, I'll close with an update on cases in Newfoundland and Labrador. Since the media briefing yesterday, we have 4 new positive cases. These cases are within the Eastern Health and Central Health regions. The public health contact tracing is ongoing, and everyone considered close contacts will be advised to quarantine. The total number of cases in our province is now 232. By region, we have 219 cases in Eastern Health, 6 in Central Health, 1 in Western Health, and 6 in Labrador-Grenville Health. 53% of cases are female and 47% are male. By age, we have 20 people under the age of 20, 34 between 20 and 39, 33 between 40 and 49, 51 between 50 and 59, 50 between 60 and 69, and 44 who are over 70. 6 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 74 people have now recovered. We must make a continued collective effort to adhere to the rules of physical distancing, to stay home except for essentials, to wash our hands frequently and well, to stay home if you are feeling sick. We are at a pivotal point right now to reduce the spread of COVID-19. It is that simple. Thank you for your time this evening, and I hope you all take care and stay safe. Thanks.
Thank you, Dr. Fitzgerald. And I also want to take this opportunity to thank you for your own personal sacrifices and your unwavering support to the people in our province. I now turn it over to Dr. Hagee, and I also would want to comment and say that this minister is doing a remarkable job in leading our Department of Health and Community Services, and I also want to thank him at this point for his hard work. I now turn it over to him for a few comments.
Thank you very much, Premier. I think Dr. Rahman and his team are to be congratulated on what is really a made in Newfoundland and Labrador approach. I think there may have been expectations that we would come out with a slightly different approach here around models. What we've done is try to develop a forecast. I draw a weather analogy. You know, everybody in Newfoundland and Labrador looks at the weather over the course of the week, and we know how variable it is. But from my flying days, I can tell you that weather is really important in planning. You look at the weather and you get very accurate short-term forecasts through the aviation services, and you use that to make a plan, knowing that a plan is just that and may need to be adjusted, and you put in alternate destinations. And really what we've tried to do is to mirror that approach with a homegrown solution. Just as with the weather, with any level of forecasting, there's always uncertainty to predicting the future. It's easy to pick holes in any forecast or prediction, and as one statistician once said, all models are wrong, but some can be useful. And I think the information presented here today is useful from a variety of perspectives. As updated numbers come in, Dr. Rahman and his team will revise their projections and run the numbers again. And when those projections change, as they will, this group will be in a position to advise us and healthcare administrators as to how best to respond. Again, it's a guide, but it's a Made in Newfoundland and Labrador guide. We've done that because we don't have the types of data and the types of numbers that you see in other territories and provinces. We have that one big localized cluster that we know has skewed our data. This approach, however, despite being unique to this province, is sound. It's been validated independently by CIHI, the Canadian Institutes of Health Information. It's an important tool that we're going to use today and in the future for planning and for preparation. But it's also an approach which can predict better what happens over shorter time periods, periods of 30 to 60 days. And we can use this at a very granular level to help the regional health authorities plan, to give them as much lead time as possible and practical to safeguard the system, yet allow for change as well. The individual health authorities will be provided with information that will be able to, which will enable them to see the impacts of what the projections are for them in their own locations, to enable them to see what capacity they have, and to enable them to see what capacity they need, and enable them also to see what they need to do differently. Dr. Rahman has referenced a potential shortfall, for example, even under the best case scenario for intensive care beds, and we're already having contingency plans as to how to address that. We may need to further refine the layout and the allocation of facilities and resources within hospitals. But as these slides indicate, these projections are based over a 2-year infection rate. This cannot be about waiting out this virus. It's about adapting to its existence and creating our own new normal. This is not going to go away anytime soon, and it's going to echo in some form or another through the rest of the year. How bad those echoes are will depend on how we behave. Now makes a difference. It's not a time for complacency. Slipping now will push us to the worst case scenario that Dr. Rahman and his team have presented, with more Newfoundlanders and Labradorians being exposed to and getting the virus over this next 2-year period. These figures also show that people 55 to 64 are those much more likely to risk hospitalization and much more likely to end up in intensive care units. Those with 2 conditions or more do less well. Diabetes and high blood pressure are mentioned on those slides, and we know that we have those conditions in large numbers in this province. They're common, unfortunately. Our greatest challenge, therefore, is to prevent the spread of the virus. The better case scenario, which is still going to be a challenge, based on what we do now and what we've been able to do, relies on us continuing at least to do that and ideally to improve on it. And certainly the discussions that are going on in our department at the moment and across government are what other advice from public health officials is there for things that we can do in addition to those that we are currently doing. But the other scenario, where 50% or more of Newfoundlanders and Labradorians acquire this virus over 2 years, shows us very clearly the awful prospect if we slip now in any way. We will simply not be able to cope without drastic changes, and even then, it is unlikely we will be successful. So what we do this holiday weekend matters. We need to take a break from family holidays. We need to take a break from going to the cabin, because your next cabin party will be our next calls. and we will not have the capacity to deal with that over the longer term. Unless you are an essential worker, the only reason to be on the road this weekend should be for your own immediate health needs. Anything else is rash, and frankly, it endangers every one of us, not just you. The virus only moves if we move. Stay safe, keep us all safe by staying home this weekend. Thank you, Premier.
Thank you, Minister Hagee, and thank you once again, Dr. Fitzgerald. In conclusion tonight, I also want to thank Dr. Rahman for his projections and his regular updates, which he's committed to provide to Newfoundlanders and Labradorians, and the great support that he has to our team. So if there is one message that I want you to take away tonight, it's this. This is not a test of our system. It's a test of you. The system fails only if you fail. What we do this weekend and beyond will make it or break it. Your actions will determine if the virus grows or it dies. So don't let up. Keep your distance and stay safe. We wish you a happy Easter weekend. For those of you who will not see us tomorrow, but for those of you who will be tuning in, it will be a regular briefing at 2 p.m. tomorrow. I thank you.
And that was the Premier, a live presentation of the province's projections, the modeling, the forecasting for the COVID-19 pandemic in this province. The Premier saying it is make it or break it time for sure. A lot of information to digest from that presentation from Dr. Proton Rahman, but the main takeaway seems to be that now is the time to stay on course and to make sure these public measures are followed, or else the consequences could be catastrophic. And Peter Cowan is with me now. You were in the technical briefing earlier today, just listened to everything that happened there. One thing that I found interesting is that we didn't hear anything about the deaths. We saw projections from Alberta and Quebec. They all outlined the possibilities, worst case scenario, probable scenarios for the deaths in those provinces, but we didn't see that. Why is that?
And yeah, those are normally the shocking numbers that really drive it home when you say, wow, if we don't do this, X number of people are going to die. And the answer is here, we just don't have enough data. Dr. Rahman was saying that we need 5 deaths in order to be able to put this into a model and start to get reliable numbers. So the answer is we've only had 2 deaths so far. That doesn't give them enough data to be able to give you anything very accurate, but they are going to be rerunning this every week or every 2 weeks, so we'll start to see updated numbers, and if they have that data, then we'll start to see some of those death totals total.
So we saw a couple of scenarios there, the worst case scenario and the probable scenario, the scenario that will be there if everything stays on course and the public measures don't change. What were some of the big takeaways for you watching all of that?
I think one of the big takeaways is even on the best case scenario, we're going to run out of ICU beds.
Right.
The good news, it's not an issue that's going to be dealing with in the next couple of weeks. That's going to be an issue for the next couple of months. But the best case scenario, they're showing kind of by the end of June, the number of people needing to be in the ICU will be greater than the number of beds. We heard the health minister has said they're working on contingency plans. And so that'll be one of the key questions, I think, out of tomorrow's briefing is, now that we know that we're going to be out of ICU beds, what are you going to do in order to try and create more beds? And there are lots of things that they can do, but they're going to have to start working on that right now. And that's the whole idea behind, implementing these measures means it's going to take longer in order to bring this out. So, can
you explain these scenarios for us? The 32%, that's the probable scenario if everything stays on course.
Right. So this is looking at the long-term scenarios. These are ones done by at the national level. We gave them the data and they ran it through their models. So it sort of assumes that over 2 years, 30% of the population is going to get this disease, because until we have a vaccine, it's going to keep going through the system. The hope is it does it slowly, So what that shows, though, is they're looking at the peak number of infections, because everyone wants to know, when are we going to get to the peak? When is this going to start to get better? It shows that that won't happen until November. This comes with some big asterisks because, yeah, that's 8 months from now.
My goodness.
And we've seen peaks in other provinces. They're talking about, Quebec is saying the peak could be the end of April. We're seeing Alberta saying May for the peak. The issue is we haven't seen a big run-up in cases. Those provinces have. So they are warning that if we, because of, say, a party on the weekend, all of a sudden 20 people get together, they get the disease, they start to spread it, we see a big uptick in cases, then we could start to see that, then that would obviously change the numbers. Let's take a look, though, at the worst case scenario in terms of the long term. So this is assuming that 52% of the people get infected with, and that's because that would be if we didn't implement these sorts of distancing measures. Everyone goes out, they start infecting more people over a shorter period of time. I guess the peak infections, it moves back to mid-September rather than November. So we see the peak earlier, but it's a much bigger peak. ICUs become completely overwhelmed, hospital beds become overwhelmed. Those are the sort of scenarios we've seen in Italy, New York, other places like that. Those are the scenarios we're trying to avoid.
How much stock do we put in this? Because Dr. Rahman, stressed a number of times that, this process can be flawed. These models can be wrong, and there's a lot depending on a lot can change. So how likely are these models? How reliable are they?
Yeah, and I feel like we should almost have Ashley Brauweiler joining us now because she looks at models every single day and she tries to project. And that's why the projections that they did here only went to the end of the month. The farther out you go, like those long-range ones looking at November, the more problems you're going to see and the less likely they are. The reality is we do have to take these with a grain of salt. This is not saying this is what will happen. I thought the weather forecast was a great analogy because it's saying this is what we think might happen a week from now. But as we all know, especially in Newfoundland, a week later, things can look very different than what you were expecting in a forecast. So I think it's, they're using these for planning purposes. They're sharing them with the public in order to have some of that accountability. So at least we get to see their notes. What are they working from? What information are they using as they try and plan for the facilities we're going to need, the ventilators we're going to need, things like that.
Certainly a motivator, I guess, for people as we head into this weekend. That was mentioned a number of times, how careful people need to be this Easter weekend. This is not a time to spend in the presence of family. It certainly seems that they are concerned that if there's any slip up in that, it could really, really change the dynamic here, just like what happened with calls, which makes up 75% of the cases.
Right, and that's, and interestingly, talking about going to the cabin, the clip from the Premier we ran earlier in the show was kind of like, you can kind of go if you want. John Hagee, the health minister, seemed a whole lot more certain on, no, don't go to the cabin. I think that's not because the cabin in and of itself is dangerous. It's while you're at the cabin and there's the neighbors you haven't seen in a long time, and maybe we'll just invite them over for one quick drink. That's the concern, I think, with the cabin, is it's a social place. People go to the cabin because they want to get together with friends, and that's what they want to avoid right now, is keeping everyone in their own bubble and not, as they say, bursting someone else's, because that's where we see transmission happen, and that's where we can see, rather than it just being 1 or 2 people who get sick, now all of a sudden it's 20 or 30 people.
And how concerned should we be about healthcare capacity right now? It talked about, ventilators and ICU beds. What do these projections, how do they play out in terms of what we have in these two scenarios?
The good news is hospital beds, we're in pretty good shape.
Take any good news right now.
It's the ICU beds that become an issue, and ventilators, it depends on the scenario. Under the sort of best case, everyone does their part with the physical distancing, the hand washing, everything we're supposed to be doing. We will have enough ventilators, if the projections hold. It's ICU beds, and that'll be the key thing, and that's why we're seeing the planning for the health departments in order to try and figure out how to create more ICU beds, because there are things they can do, but they're going to have to start doing them now in order to be able to meet that surge. So it'll be interesting. We'll keep an eye on these numbers. They're going to, as things progress, as we get new data, They're going to update those, so every week or two we'll start to see new numbers, and the only thing I can guarantee is that I'm sure we will start to see very different scenarios play out as they get better data and they feed it into these computer models.
How worried do you think people should be after what they just saw?
I think what they're worried about is people getting complacent, because it's sort of been a month since we've seen the first restrictions, and it is tiring to not be able to, see friends, to have small children who have tons of energy and very limited ways that you can burn it off, all the normal things like, oh, go play with some friends. You can't have them do that right now. So clearly from their comments, I think my big takeaway from that was they're worried that people will just sort of say, maybe I'm just so tired of doing this. I'll try and find a loophole, or I'll try and relax a little bit. And especially with the Easter weekend where we traditionally do get together, that's why they really drove the message home. And I think that's why they picked 6 o'clock as the time to do this briefing. They wanted to address the whole population. Worth noting, of course, they didn't take any questions from reporters today at the briefing, although this is the first day in 28 days, I think, that Janice Fitzgerald hasn't been available to answer questions from pesky reporters. So they have promised it'll be back at it tomorrow, and we'll have some of these follow-up questions for them about, now that we know the numbers, what are they going to do about it?
Yeah, so we'll see what tomorrow brings. 2 o'clock, the briefing tomorrow. I'm sure you'll be asking your questions.
I will be there.
For sure. Thanks so much, Peter, for giving us some context and breaking it down for us.
Anytime, Carolyn.
So now we're going to go to another expert in modeling and forecasts. Here's Ashley Brawweiler with the weather.
Another pretty nice spring day across the board. Let's take a look at where we sat temperature-wise. Again, near seasonal. We're sitting around 1 degree as our afternoon high in St. John's. Corner Brook saw a high near 4 degrees. That was the hot spot, and then about 2 degrees was the afternoon high in Happy Valley Goose Bay. So we still have that area of low pressure spinning counterclockwise, and we'll continue to do so as we head through the overnight tonight. We're seeing some areas of cloud cover and some scattered flurries with that, and that's pretty much the story tonight, except we will see some cooler temperatures. Certainly areas along the west coast and in those lower elevations will probably see temperatures dip into the minus double digits. And overall, just dropping a couple degrees pretty much for eastern areas of Newfoundland, and then up through Labrador, especially through pretty much around Nain. You're looking at an additional 5 centimeters by the time tomorrow morning rolls around, with snow, some areas of light snow or flurries for the rest of the big land. Now tomorrow, that area of low pressure we're still going to be under the influence of that, so not going to see much movement in temperatures or what's really going to happen. So probably some cloud cover on the west coast, and then parts of the east coast as well. Eastern areas of Newfoundland, rather, with some scattered flurries. Through central, looks like plenty of sunshine. Those winds will ease a little bit, generally light, 15 to 20 kilometers per hour, and then up through Labrador as well, light winds with a little bit more cloud cover in play for you, and some light snow or scattered flurries will be the story. So, turning our attention to Friday, that's when the next area of low pressure is going to move in. Significant weather. Winds really ramp up in the southwest in the early morning hours. Then we're going to see snow start. That's going to quickly change over to rain into the afternoon, especially for areas along the east. And snowfall amounts with this one, generally 5 to as much as 10 centimeters of snow, and then ending as drizzle through areas of central and the west coast. Eastern areas rather, is where we'll see the majority of the rain. Northern Peninsula, southeastern Labrador, probably closer to the 10 centimeter mark, with some areas of blowing snow as well, with the winds really ramping up. Like I said, this will stay as a snow event for most of Newfoundland, or most of Labrador rather, and then it's going to stay pretty unsettled as we head through the day on Saturday. Now, Environment Canada has already issued a wind warning for the Wreck House area. You're looking at gusts between 150 to as much as 160 kilometers per hour. Anticipating we'll probably see more wind warnings with that one as the days, or at least through tomorrow is when we'll probably see those wind warnings issued. Temperatures into the afternoon will bump up into the 4 to 5 degree range for most of us, hence that change over to rain. and then staying around just a couple of degrees within zero for the big land as we head into the day on Friday. So hopefully last night you got out to check out the super pink moon. We got a lot of beautiful shots there. I wanted to share this one with you from Vanessa Mooney. Great shot there. Thank you so much for sending that in. And if you have any weather photos to share with us, send them to nlphotos@cbc.ca.
Thanks so much, Ashley. Now to some national news. The federal government is making some changes to its financial help plan for Canadians. That includes adjusting the requirements for the wage subsidy program and adding more money to the student summer job program. The subsidy program still needs to be passed by Parliament before it can go into effect. Julie Van Duzen has the details.
Businesses are trying to ride out COVID-19, trying to survive till the deadly pandemic finally lifts. And that includes airlines. Today, Air Canada announced it would rehire the 16,500 employees it laid off last week by tapping into the government's wage subsidy program once Parliament approves it.
It's great news to see the fact that Air Canada has retained these employees. That was the exact intent of the wage subsidy.
The government says it will make the wage subsidy more flexible. Justin Trudeau says businesses can now qualify with a lower revenue drop last month than the one that was first announced. That will mean more businesses can benefit. More employees will be kept on the payroll. That's more chance the economy won't tank completely.
The absolute objective is to make sure that we have all the tools that we need to prevent that recession from becoming a depression.
The opposition says the need is urgent, that the U.S. government has been much faster with its financial aid.
If these businesses go bankrupt, you will see millions of people forced to go to food banks. Many will become homeless. There will be an enormous increase in poverty.
As for the millions of employees who have been laid off so far, they're rushing to tap into benefits that are newly available.
To date, we have processed 3.87 million total CERB claims. This means since March 15th, millions of Canadians would have seen and will see their first CERB payment of $2,000.
Also today, the government announced changes to the Canada Summer Jobs Program. It will boost the wage subsidy up to 100%. It says that will help create up to 70,000 jobs for young people in essential services, about the only kind of jobs that still exist in this pandemic. Julie Van Dusen, CBC News, Ottawa.
Well, some good news from China. Exactly 100 days after the first alarm over coronavirus was sounded in Wuhan, the lockdown of the city is officially over. An extravagant light show was held at the stroke of midnight to celebrate the lifting of the 76-day-long ban on entering, leaving, or moving around in the city. But it's not a complete all clear. Wuhan's 11 million residents must still wear masks in public, keep up distancing, and stay home as much as possible. The end of the lockdown triggered a mass exodus from the city, as non-residents who were trapped in the city when the lockdown went into effect were finally able to head for home. But they've got to have a certificate and a QR code proving that they've received a clean bill of health. According to the China Railway Corporation, 55,000 people left Wuhan today. And a goodwill gesture can go a long way these days, especially when it's unexpected. Many people in communities in and around Hamilton, Ontario, were surprised to find flowers on their doorstep over the weekend, and the mystery delivery came with a note.
The card said, "We have plants that currently don't have a home, and we'd like to spread some cheer to you and your family." I thought, are they giving flowers to everybody in downtown Hamilton? I was trying to think the last time that I've been given flowers. I'm usually the one giving flowers. It was like the Easter Bunny left flowers for me when I got home.
The flowers are from the Ravensbruggen family, who operate a large greenhouse. They can't open their store right now, so they decided to save their plants from the compost and at the same time spread a bit of hope. An early Easter gift to thousands of people who can certainly use the smile right now. Well, this pandemic has been particularly hard on seniors. Many are isolated in their homes with little to do and few, if any, opportunities to interact with the outside world. But one retirement residence in Quebec City has found a great way to connect across, up and down, or corner to corner. Yes, they are playing bingo on their balconies or at tables set up outside, all in keeping with physical distancing rules. A loudspeaker is the key, of course, to making this pandemic version of the game work. Balcony bingo is played there twice a week, so residents on both sides of the building can take part. Well, thank you so much for joining us on this special edition of Here and Now. We were on air for an hour and a half tonight with some coverage, live coverage of the Premier and health officials talking about the projections for the COVID-19 pandemic in this province. Tomorrow we'll be hearing more for sure. I'd like to thank Peter Cowan once again for being here with us tonight. Have a great night, everyone.